agenda that they have to take care of. So I, as a sheriff, I'm going to ask you to be respectful of their business. We want to keep the noise down in here so that they can conduct their business. I think it's going to be a fairly short meeting. And so they're going to be speaking into microphones so that you all can hear. We've got some of their board is going to be on Zoom to take part in the meeting. So we've got a microphone set up so if that person speaks on the computer, then it'll be out for you all. The media is here present. What we've arranged for the media, if any of you want to talk to the media or the media wants to talk to you, following the meeting, we're going to have the media take a position out in the courtyard, which is the, when you came in the front door, you can see the outside area. So you're welcome to go out there. There is actual business going on throughout the courthouse today, whether it's my office, the assessor, or the court clerk, or the county commissioner. So please be respectful of that. We're going to make sure that citizens still have their right to go do business today, while you all have your right to be here and listen to this meeting. So with that, I just want to make sure that if people do get unruly, we are going to ask them to leave because we want these folks to have their business taken care of. But the main thing is we want to make sure that you're all comfortable. There is limited seating in here. If more people arrive than we have seats, I'll ask you maybe to hold your sign versus taking up a seat. And then once it's just to the point where there's no more room, we'll ask people to stand out in the hallway. And there's no way for us to actually push that information out there in terms of the microphones, but we'll do the best we can. So thank you. Hope you enjoy it. Thank you, board, Mr. Chair, and Nikki. I'll turn it over to you.
Hey, Sheriff, I got a question for you.
Okay, you got 10 seconds.
If there's a mandatory wearing of masks, why aren't all your officers wearing them?
There is not a mandatory order to wear a mask.
I thought I heard some sign that said July 4th, Governor Little said there was.
There is not a mandatory order to wear a mask. You're in Canyon County right now. You're not noisy. Welcome to be here again in this room. So I'm not going to take any more questions. It's not my time. This is the board's time. I'm going to turn it over to them so they have their meeting. Thank you.
All right, so a couple of quick items before we get started. My name is Ashley Anderson. I'm a health education specialist and PIO with Southwest District Health. I will be moderating the Zoom side of today's virtual component. Please note the following. Please be mindful of your conduct in today's meeting, as this meeting is being recorded and will be made available for later viewing. If it is available, and should be, for later viewing, it will be available on our YouTube channel and likely the Southwest District Health website. So stay tuned for that. We are not accepting public comment during today's live meeting. Please refer to the meeting notice and agenda. We welcome email comments, questions, and feedback to publichealthidaho@phd3.idaho.gov anytime. Let's see, please direct any virtual or Zoom related questions, comments, or concerns to the moderator or myself. That applies to our virtual or distance attendees today. And I think with that, now I can turn it to Commissioner Elliott to begin today's session, if there's nothing additional.
Okay, thank you. I started too quickly. Appreciate Sheriff Donahue, appreciate his remarks this morning. We do have business that we need to conduct. We've been trying to do this for a while. So I will reiterate that we are not taking input at this present time from the public. We've already done that. I'm a poor speaker, so I'm a farmer, and I'm a master electrician. I'm really not any kind of a public person, other than the fact that I am a county commissioner, as well as these folks here. Everybody's that kind of that direction, except for Dr. Summers, who is also a member of the board. Today we have, if you look at the agenda, we have some things on the agenda, and that is all that we're going to cover. That's all that we're allowed to cover by our meeting laws, is what is on the agenda and the way that it is shown. So if there's something there that's shown as an action item, this is just for your information, we can vote on it as an action item or take action on it. If it's there as an informational item, we just receive information from whomever, that the chair, I don't know if you remember some of the old movies that where there was a statement, it's good to be king. I'm not king, but I do get to choose. and allow certain things at this meeting. So with that, we're calling this meeting to order. I'm not a big gavel guy, just assume that it's happened. Anyway, the meeting is now called to order. And to start with, we will have the Pledge of Allegiance like we always do. Today I would ask Commissioner Dale if he would lead us in the Pledge of Allegiance.
And remove your hats, please. Thank you. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Amen.
Okay, thank you very much. Okay, right now I will turn the time over to Nikki. He has an overview of the public comments that have been submitted electronically to the Southwest Health District. I'm sure every one of the commissioners have received a myriad of comments in this last period of time. My phone's been smoking. I might have to get a new one. I also received a notice that my email cache is about full, so I'll have to have our county IT guy give me more room. But with that, we'll turn the time over to Nikki.
Thank you, Mr. Chairman. I may also add that we have, I believe, 2 other board members joining remotely. Commissioner Nate Marvin from Washington County and Commissioner Georgie Hannigan from Fayette County. So my team, we worked to pull all the public comments that have been provided together in a brief summary to provide to the board. In your package, you have what was collected through the Survey Monkeys. We also collected data or comments from the Public Health Idaho with an email address that we have. We also have numerous phone calls that we received through our call center and to individual staff, as well as emails to individual staff, including myself. The comments, I just want to make sure and clarify that this wasn't the scientific poll, so these are estimates and summaries of the information. And we did not verify residency of people who provided comments that wasn't requested, although some provided it. And based on who did provide it, we had comments from Adams, Canyon, Gem, Fayette, Hawaii, and Washington counties, as well as residents from across the state. We had over 1,300 public comments in our Survey Monkey that we had posted out onto our website. And we, in summary, most of the concerns were around mandatory face coverings. In general, I divided the feedback from kind of mandates versus non-mandates of public health measures to mitigate the spread of COVID-19. And we had roughly about 58% of comments that were opposed to mandating face coverings and other public health mitigation strategies. The overarching themes that we pulled from the comments were included individuals should have the right to choose and make informed decisions, concerns that mandates are unconstitutional and an overreach of government, concerns for safety and the effectiveness of face coverings and the false sense of protection some may provide. There were comments about recommending but not mandating face coverings, recommending face coverings in indoor spaces and for staff and students. Let's move to stage 3, which, as many of you know, was not, there was no mandate for face coverings. So I think that's the direction of that comment, or those comments related to that. CDC recommends face coverings and do not mandate 1 person per 64 square feet when space is limited or defined in a defined space. And I might just step back to and characterize some of the general comments. Most of them came from general members of the public. They didn't identify like their backgrounds or occupations. And then we had a large number of people who are educators, and I think just concerned about schools starting and what the impact of COVID-19 will have on their operations in the school setting, and then also from healthcare providers and in terms of clinics, long-term care facilities, and hospitals. And then going back to the overview of the comments, about 42% of comments were in favor of mandating face coverings, rolling back to a previous stage, limiting mass gatherings or limitations of persons per square feet, and other mitigation strategies such as limiting large gatherings, delaying school opening, or using online methods for education. And the overarching themes in those comments were evidence-based mitigation strategies are known and effective. They provide for safer community environment. Stricter mitigation strategies will decrease my risk for exposure at work. And those comments primarily came from small business owners, teachers, and healthcare workers. Protect vulnerable populations. Educate the community about face coverings. Face covering mandate for business, and there were comments for private and there were comments for just public. Some were general. Face covering mandate for Canyon County. Short-term face covering mandate. So there were some comments on instituting a mandatory face covering for 14 days and then anywhere up to 60 days, depending on the comments. There were also comments about hospitals, predictive models, and observations over the past 3 months that indicate without implementing stronger community mitigation measures in place, ICU bed capacity will be exceeded by mid-August. Concerns of increasing trends of new cases and their impact to the healthcare system, availability of personal protective equipment, such as gowns and gloves, as well as testing supplies, are beginning to be impacted and are less available now. Concerns for the capacity to provide necessary health care for non-COVID conditions with the surge in new COVID cases and the increasing trend of hospitalization. So meaning that at this point, some of the hospitals in our region are needing to postpone elective procedures or outpatient services or are concerned that that will be happening very soon. Meaning the next 2 to 4 weeks. And healthcare provider fatigue and healthcare provider staffing shortages due to illness or exposures are impacting operations. There were comments about limiting large and mass gatherings as well. And the last one I have on here is local public health authority has a responsibility to protect the health of the community. And that summarizes largely the 1,300 comments that we received both for and against mandates or related to public health mitigation strategies in our region.
Okay, is there any board members that have questions or comments for Nikki on what she has provided? Okay. Before we get to go starting on our discussion, I would like to, as a board member personally, not as the chairman, take just a second to describe to you folks so that you understand, and I think, and pretty much I think board members already know my direction on this, but as a member of the board of Southwest Health District, I was put in this position by the other 2 commissioners in our county, as were every other board member except Dr. Summers, who is not a commissioner. Anyway, with that, I was put into this position, and in this position, I think that in this particular meeting, what I am looking to do, what I think is our responsibility, or my personal responsibility, is to make sure that people who need to be able to receive medical attention can do so when they need it. And to me, that is the main responsibility that I see. We have an uptick, a surge, a spike, whatever you want to call it, in the number of cases in, I think, every county that's in our district. We have certain people who are able to predict these trends better than I, because they're trained that way, That's their specialty within within Southwest Health District. There's a lot of people that have different jobs, different specialties, different training, as well as the predictions from the hospitals and the medical facilities. But I come down to the point of what needs to be done, or are there anything that needs to be done? Now, I want to look at all the evidence to make sure that these people, who might be me, might be my wife, my kids, my grandkids, your family members, whoever, that's what's happening. Most of us are going to need, I won't say most of us are going to need, but we'll at least be exposed to, unless there's a development in vaccine real quick. But anyway, there's going to be people that need to have medical attention. And that's my personal thing, is how many of those people can get the medical attention that they need? At the present time, everybody can. And that's the only thing that we're really looking at. Well, perhaps by income or whatever, I don't know. You know, I see these heads saying no, that they can. But at least the available spaces exist at the present day at the medical facilities. So that's the direction that I'm coming from. What can we do? What do we need to do? Is there anything we need to do? And if so, what is the least, anything that you do puts some imposition on folks. We realize that. We wouldn't want to do that, but I think that's our responsibility, is to look out for the health of those people that need to have these things. So that's my particular direction. If the board members wish to have any other statement as to what they are trying to do with this particular meeting, I'm not talking about, there's a lot of things that the health board does that's different that we're not talking about today. We're not going there. Basically, it's just these three things that are on the item that agenda today. So with that, I would invite, if the board members have anything they'd like to add on their own personal, I'll give them a couple of minutes each, and if not, then we'll go right on into our discussion. Okay, so and I'm not speaking for the board again, I'll let them each speak for themselves, but it sounds kind of like that's the direction that we're looking. Okay, so we need to start the discussion of possible decisions regarding mitigation strategies in order to spread to slow the spread of COVID-19, possibly also to limit exposure to high-risk populations. And some of these, the first one is a recommendation to wear a face covering when Southwest Health District COVID-19 health alert level is at or above yellow, which is low in public areas. We have put, Southwest Health District has put together, I don't know, has this been disseminated? Okay, so it's posted. Okay, so you can see there kind of what different levels we're looking at depending upon the numbers. Basically, they're all dependent on numbers. But you can go to the website. Evidently, this is there. You can look at it. I haven't looked at the website because I had the paper. And I'm way better on paper than I am on electronic stuff. Anyway, so that's what we're looking at when it's at or above the yellow in public areas where physical distancing of at least 6 feet between non-household members is not possible. The second thing we will discuss is the recommendation to limit the density of people at events to a minimum of 1 person per 64 square feet of space when the level is at or above yellow again, and possibly a recommendation to temporarily suspend visitation to older adult living and correctional facilities when new cases of COVID-19 are detected within the facility or when Southwest COVID-19 health alert level is red, which is the high level. There are, the last one especially hits home to me. I have both family members and good friends who are at high risk in some of these nursing home facilities. As of the present time, none of them have got sick, but there have been people in some of those facilities that have, and they all have health problems, or they wouldn't be there. Anyway, they can't take care of themselves. So, to me, just as a societal thing, I think that's something we need to look at, to just be able to care about and try to protect that particular vulnerable population that can't do that for themselves. So with that, commissioners, I would stand for any discussion. If not, I will ask for some input.
Mr. Chairman,
Yes, ma'am.
well, there's quite a few things. Mask mandates that have been put in place in other states.
We're not talking about mask mandates.
Okay.
We are not bringing
Do you
it
want to
up.
talk
It's
about
not on the
brought up masks? Do you want me to discuss that at all? Or, because I guess I'm talking about in the long-term healthcare facilities, they've already been wearing PPEs and masks for months.
They have.
And that is where the majority, I believe 80% of the deaths have happened.
Correct.
So I guess I'm concerned that if we put any more mandates on long-term health care,
We are not speaking of a mandate, Vicki.
Yes, sir. I appreciate
What I have said is recommendation,
Okay,
and we will stick with that.
okay,
If you can't stay to that, then I won't call on you again.
yes, sir. That's okay.
Okay, we are going by what is on the agenda.
I know, I absolutely appreciate that. So I guess I'm just concerned that if we put any more recommendations on some of these long-term healthcare facilities, that the mental health consequences will be far worse than anything else that could happen. So, so I guess I'll just leave it at that. But those are my concerns, is that we're making things worse instead of better.
Okay. It is not a mandate. Most of those facilities are private, and they've already put their own requirements in place. Yes, Commissioner.
Mr. Chairman, Hawaii County has already used this alert, red, yellow, minimum, I think red, yellow, and gray alert. We've already used it for our demolition derby. It's strictly for information for those people that go there, so they have an idea of that they're entering into an area that is at high risk. And I think that's a great thing for us to do. And, it's just a recommendation. If you're going to go into an area like that, it's up to you to choose, but wise decision would be either stay home or wear a mask, if you have any concerns. Otherwise, enjoy it. But we do know that after our derby that we have seen an increase in positive tests in Hawaii County because of that. So, but the people have the freedom to choose which way they want to go. So.
Thank you. Yes, Commissioner Dale.
Yeah, Mr. Chair, I'll just make a couple of comments here. I think as we move forward with our recommendations, it is important, I think, to understand and accept, underline those two words, understand and then accept that there are numerous opinions on all of these issues that we're talking about today. And just because somebody disagrees with you doesn't mean they're a bad person.
That's true.
We are in a state in a nation where we seem to be unable to disagree without saying that person's a crummy person because they disagree. That's not helpful. We also need to accept, and I understand and accept, that this COVID-19 virus is a serious health concern for our counties, for our cities, for our state, for our nation. It's affecting all kinds of people in all kinds of ways. And it is serious. So I also personally largely accept the recommendations that have come down from the CDC as far as methodologies that can be used to mitigate and reduce the risk of contracting and the risk of spreading this virus. And I think most of us are aware of those things, such as masks is one thing, hand washing, sanitizing surfaces, sanitizing areas, and for Pete's sake, if you're sick, stay home. So those are the kinds of things the CDC is I believe our folks at Southwest District Health and other health agencies are doing contact tracing to try to identify where the hotspots of spread are occurring. What we have learned through this, and this is a method that we can do to make recommendations to how to protect ourselves. A lot of this spread is occurring at private gatherings like graduation parties, weddings. I was at a wedding last Saturday, and they took the steps of requiring everybody at the wedding inside the building to wear a mask. It was a private party. It was their right to do that. Don't denigrate them for doing it. They did that of their own free will, and that's the way it ought to be. We're aware of those kinds of things. These are hotspots. We also know that work is a place where people are getting this as well. So we encourage people. I encourage people to take this seriously, and knowing where you're going to go is a hotspot. You can protect yourself and protect others as well. I will also say that we have seen in recent days that people are stepping up to take precautions. We have seen this week that private businesses such as Walmart, Fred Meyer, and Costco was weeks ago, I guess. But businesses are stepping up, and they have the right to say what conditions will be met to enter their facility. We've seen no shirt, no shoes, no service often, and that infringed on a lot of people that wanted to go barefoot this summer. This is their right to say what they want to require to enter their facility. So that is their right, and it should be there, not in the hands of government. That's my opinion. I believe that we need to do things that are positive and make positive statements and positive. We have to work together on this. If we don't, we're gonna see consequences. And so that's my statement, Mr. Chair, that we're all in this together. Let's do the things we know that work to help contain this.
Okay, thank you. Anything else, Dr. Summers, or anybody that two commissioners that's on Zoom?
Yeah, Mr. Chairman,
Yes, Nate.
I'd just like to echo, everything that's been said so far, and I'm not going to repeat everything that's been said, but I am glad to see these recommendations, and I can go along with them. And I think we need to be diligent in our efforts. We've got school starting in a few weeks, and there's a lot of what ifs affecting our school children, our teachers, our education system. So I think we do need to be diligent and try to get this under control. And hopefully this is a good start towards that.
And thank you, Nate. Appreciate it. Yes.
Go ahead, Bill. I have one more thing I would like to make very clear. I'm very Christian, so I want to make this out. The good Lord says that we are to love our neighbors as we love ourselves. So I think that it's very, very important that when we go outside or we're around other people, that we respect and love those people as the Lord requests us to do, and that we do the right thing. And if that puts, I personally, if I'm going to be around a lot of people, which I didn't realize it was going to be like this here, but I have the opportunity to wear a mask or not wear a mask. I think it's my responsibility to be careful and not to spread something to anybody else. And so I think that's something that everyone needs to look at when we're doing this. That we look at loving our neighbors as we love ourselves. Okay, that's as far as I go.
Thank you. Okay.
Brian?
Yes.
So there's lots of information regarding this, and and on both sides of the fence. I will argue that the vast majority is for masking, social distancing, washing hands, etc. But you can interpret this information differently. I personally think we've already had, in 2 months, 3 months, there may be a whole bunch of different opinions about this. But I think we've had a wonderful experiment already with this. When COVID first came and it hit New York and the government got shut down and we had social distancing and et cetera, the rate of COVID dropped dramatically. As we started to release it, what has happened? The COVID rates have gone up dramatically.
How do you determine cases?
Okay, we're not taking that. And, you know, either the meeting will disband, we'll stop it, or if these folks feel like they need to clear this out, then we will. I think that.
The gray jacket finish speaking because she's
I think this, sir.
You didn't allow her to speak.
Sheriff, would you remove that man, please? I told you immediately from the beginning, we were not going to allow this. I'm not going to let this meeting turn into a circus.
I can't stay here and listen to the meeting.
If you can listen, that's fine. If not, we're not going to take any more outbursts.
But the lady.
Okay, you're done.
I won't say another word, I promise.
Okay, thank you. Okay, Commissioner Hannigan, did you have anything to add?
I will say I agree with most of everything that's been said this morning. I agree with you that I have some concerns about healthcare capacities. I'm glad to see that these are recommendations on our agenda. That's about all I've got to add right now.
Okay, thank you. Yes, Vicki.
Yeah, from reading all the hospital data, it looks like they're only about 50% full.
At the present time.
At the present time, yeah. And I guess I would like to note that so far, nobody's models have been correct. So, they have for 6 days and they have gone down for the last 4 days. So I don't think that I mean, we can make recommendations, but nothing has been exact or correct. The numbers have gone up, they've gone down, the recommendations have changed, they've gone back and forth from masks to no masks. And I can tell you that mask wearing for a whole lot of people does not work out.
Okay, I go back to what Dr. Summers said. Yeah, this whole thing has been sort of an experiment. Who knew everything? Who knew everything about COVID to start with? Nobody did. It was brand new. There's a lot of things that's been learned. There's a lot of treatments that's been tried. Most of them have failed. I guess some of them are somewhat effective. We don't have a real treatment that takes care of it yet. We don't have a vaccine that takes care of it yet. I would like to add one thing just as an anecdotal thing. Yesterday in Jim County, I was told that we had 6 of our county employees that were sent home with COVID. One of them was a sheriff's deputy, worked in the sheriff's department, and he made a statement that shocked me. He said, "I thought this was all a farce." Well, I guess he knows that it isn't. I can't believe how many people actually believe that it doesn't exist. But anyway, just as an anecdotal something that, like I said, that I couldn't really believe that people don't understand that it's real. It is real. What the answer to it is, nobody has that yet. Okay.
Mr. Chair,
Yes, Tom.
I'll just say one other thing. I'm going to try to avoid using the M word. But in my opinion, and what I've learned after over 20 years of being an elected official in positions that require us to make difficult decisions, and sometimes to pass ordinances and laws in the city level and in the county level, and the instruction that I've always got from our attorneys and from my police chief in Napa City and from the sheriff here is that if an organization, if an authority passes an ordinance or a law or any kind of statement that cannot be enforced, you've actually weakened the integrity of that government authority, and you've also accomplished nothing. And so that is, I am not a doctor. I started out my college career at Northwest Nazarene College back in 1968 as a pre-med major, but I then dropped out of school, went into the Navy for 4 years, and came back as a psychology and music major. So I'm not a medical person, and I'm not going to argue the pros and cons of medical things. But I will say this, that as a public official with authority and lawmaking, ordinance passing authority, I believe we have to be careful in those laws and ordinances that we pass so that we don't weaken the system itself. And I believe we're going down a good track to make strong recommendations and encouragements of people to take this seriously. Mr. Chair, this is a serious health issue in our country. We cannot ignore it or assign it to some sort of conspiracy. It is serious, it's real.
And thank you very much. I agree 100%. The one thing that I kind of wish that was on in this discussion was education. You know, after hearing the deputy the other day, I was like, look, you know, maybe we do need to do more education rather than so much bickering about what to do. Education as to what the disease actually is and how it affects different people and, you know, different age groups. There's a lot of things that we have learned over a period of time, and we need to disseminate that information and educate folks so that they can make good choices. That's basically the way I look at what it comes down to. Is there any other questions that you have, commissioners, for either Nikki or her staff?
Yes, I have one, Mr. Chairman. I'm surprised to see this 64-foot. We had a Republican convention in Idaho well over 14 days ago and had almost 600 people there. I don't say that there was very little social distancing, but as far as I know, not one single person was not sick from that. But as far as the schools go, our kids are at very low risk, and there are maybe a few that are getting it, but very, very few. And something else I wanted to point out is instead of talking about cases and numbers, we should be just talking about hospitalizations, the length of stays, and the deaths. 20 deaths a month. And although that is like total deaths, and that includes probable cases as well, quite a few actually, probable cases. So, I mean, 64 feet, we're going to run out of real estate. I realize Idaho only has 1.78 million people, but that's the onus that we're putting on our schools, our businesses. I mean, we are dropping in GDP over 4%. So I guess, I mean, and it's expected that the United States will drop from number one to number 6 within the next couple of years because of the mandates and the things that we're putting on people all over the country. So I don't know, you know, how many more restrictions we want to consider or put on people. So, and I know
Not a restriction, it's a recommendation.
Correct, but
Yes, Commissioner. Yes, ma'am.
I can address it.
Yes, would you tell?
The spacing of one person per 64 square feet is based on the questions that we have received from a lot of public event venue holders. And they're asking for guidance, so because they want to operate, and they all want to operate safely for those citizens that they serve that have concerns about their dog, and also just be able to continue to do that. So that specific piece is really only for, like, if you're going to have an event at the Indian Creek Plaza, or a wedding somewhere, or a sporting event, and we've been asked repeatedly, like, how many people can we put in that space? And it had to be very generic. Well, either when there was a limitation set by the governor, we could say, well, you can only fit 50 people in the Idaho Center. Well, to me, that doesn't make a lot of sense when it's such a huge venue. So we tried to use a different strategy in approaching that. And if the board doesn't support that, and they have other ideas on how we can help provide good recommendations and guidance to our community to help them hold events in a way that they feel is safe for the patrons, I'm happy to take that into consideration and continue to work on it. That is what we were asked to have been asked for. Again, people seeking their guidance from us based on our expertise, and that is what we've come up with. But again, like I said, we're open to changing that to something different. Or
I just want to reiterate something you said, Nikki, and that is, this is guidance that people are asking for. It is their personal choice. It's not the district saying, this is what you got to do. It's saying, here's what we recommend. And that's exactly what you said, which allows for personal choice. And I think that's the proper thing.
We're a health district. We're here to serve the people, and they look to us for education and guidance and recommendations and information. And we do our best to provide that. So, like I said, if that's something that you feel should be a different recommendation, I would appreciate a different recommendation be given to the district that we could share with the public to address their concerns. And I want to also just mention, in terms of case numbers, the reason that's valuable to us is to understand what the denominator is, understanding that we don't know fully the denominator because of testing shortages, and then not everybody needs to be tested. I think we recognize that too. So, but it helps give us a sense of how the disease is moving through the community over time. And so if you only look at hospitalizations and deaths, you wouldn't know, well, how many people were actually sick and that, or how many people have been exposed. And that helps gives us a sense of the overall picture.
Okay, thank you. Do you have any other questions for Nikki or comments on what's been presented?
I was just going to say that I'm looking to do the same thing with my extension office, because we plan on continuing to have our fair, our rodeo, but I want to make sure that we have the information out there for people to make smart decisions. And that's what I was looking for. Thank you, I appreciate that.
Thank you. Well, yeah, Jim County's still having their rodeo also. Yesterday, Commissioner Butici was out marking off 6 feet in the stands.
And Mr. Chair,
And whether people wish to follow those guidelines, if you really want to know, a lot of that has to do with the liability factor. That we are showing that we are trying to follow the recommendations both by the CDC and the governor. So that, but still try to allow things to happen. There has to be some common sense in all of this. Maybe we've got common sense, maybe we don't, but I think we're trying. But anyway, yes.
Yeah,
yes,
Mr. Chair, I just want to point out, we were all disappointed in Canyon County when both the Snake River Stampede and Caldwell Night Rodeo canceled their events. But I want to point out and make it very clear that that was their decisions as private individuals in charge of mitigating liability, both to the participants and to the spectators. That was not a government decision in any way, shape, or form. It was done by the private sector, which is the proper place for this.
Okay, thank you, sir.
One more comment, perhaps somebody could enlighten me on the conditions of liability. So these are all.
I don't think anybody knows that yet, Vicki. I know that there has been some cases, and I know that some of the cases have actually been awarded. So I think that at the present time, yesterday there was a large discussion back east, supposedly. There was supposed to be a large discussion, at least it was a small one, in the Senate about trying to limit liability for businesses that open back up there's a lot of businesses evidently that are concerned to even open up, because if they do and they are sued, I mean, our court system is a little different. Anyway, there's things that are awarded that baffle my mind, but it does exist, and it has, absolutely, there has been some awards.
Mr. Chairman, that's another concern of mine. If we make more recommendations and people don't follow them, does that make the liability on private businesses and venues?
Nope.
Okay.
That doesn't change. I don't believe so.
Okay, thank you for that.
It's still their choice at that point.
Appreciate that.
But that's what we wish to do, is to just make some recommendations with some intelligent backing, with something that, with statistics, with whatever, that gives people the opportunity to look at it, and then they make their own choice. They can make a good choice, they can make a bad choice, and time will tell what that is. I can't say what it is. Just the same as we can't say exactly what the numbers are going to be 3 weeks from now. They may go down, they may go up, I don't know.
Yeah.
Nobody does. All you can do is actually try to predict them, and hopefully, like I said earlier, make sure that people have the ability to be treated if necessary. That's all. Okay. Is there anything else, Nikki, that you'd like to add?
Not at this time, thank you.
Okay. Commissioners, anything in particular? If not, then I would stand for a motion for recommendations of 1, 2, and 3 as listed.
Mr. Chair, I think we've had good discussion here. We've had good information disseminated both to the board members through Southwest District Health. And I really want to commend Katrina. She's been very quiet over there. She has taken on the role of Public Information Officer for Southwest District Health, which is a brand new role for her. And she has been a stellar person in taking care of this. So Katrina, thank you really for all you're doing. And folks, treat this lady with respect, and because she deserves it. She really does.
Thank you very much. I know she's been hammered in trying to do her job.
So,
yes.
Mr. Chair, that being said, I will make the motion that we authorize this health board to issue strong recommendations. And I say, it doesn't say strong recommendations. I'll say recommendations to wear face coverings when the alert level is above yellow in public places where physical distancing of at least 6 feet between non-household members is not possible. Number 2, recommendation to limit the density of persons to events to a minimum of 1 per 64 square feet of space when the Southwest District Health alert is above yellow. And 3, recommend to temporarily suspend visitation to older adult living and correctional facilities when new cases are detected within the facility. Again, this is recommendation, and these people are asking us for recommendation. This is what we're giving. These are not mandates.
Okay, thank you, Commissioner. I have a motion. Do I have a second?
I'll second.
I have a motion and a second. All in favor, please say aye. Aye.
Aye.
Those opposed, nay. Okay, we have 1 nay, and so the motion carries. Okay, so with that, I am going to adjourn the meeting.
Hope you all get voted out.
They have the opportunity to do so.